When I was in high school, I always wanted to be something in the medical field. I started out as a volunteer at a young age. My mom was a nurse. Decided on nursing just because it was kind of something in the family, and really seen the nurses influence the care of the patients and work more with the patients, and that's really what I wanted to do, was work more with the patients. Transplant, I actually started out here at CAMC as a nurse extern in the dialysis unit. I worked there for a year while I was finishing graduating from nursing school. As soon as I graduated from nursing school, I was offered a position as a nurse. Worked in the dialysis unit for about 3 years, and a job opening came open in the transplant department. Was always interested in transplant when I worked in the dialysis unit. My whole nursing career has been in kidneys. Working in the dialysis unit, I've seen a lot of patients that would get transplanted, and just seeing the difference in the patients once they got transplanted compared to the patients on dialysis, I wanted to be a part of that. We have a certification process with transplant coordinators that you can become a certified clinical transplant coordinator. That's what the CCTC is. With the certification, you have to become certified not just in kidneys. You're a certified clinical transplant, so that means the test is on not just kidneys, but heart, lung, liver, pancreas. It's on all the organs that are transplanted. There's a lot that goes into getting the patients ready to be transplanted. We have to make sure that their heart is ready for the surgery. We have to make sure they don't have any malignancies, any cancers, anything like that. No infection. You have to really screen the patients before the surgery. These patients are on dialysis, so some of them are fairly sick. So you have to just make sure that you do the testing so that you're doing them a benefit. That, making sure that transplant's the best option for them. For some patients, it's not. But we do the screening and make sure that we have them ready for the transplant. We go over it with the surgeons. Then we have a selection committee meeting that I go to every week. We meet with the team, the social worker, the dietitian, the surgeon, the pharmacist. We all meet, and I'll present the chart, say who the patient is, go through the testing. And then we, as a team, it's no one person's decision. As a team, we'll say, okay, they're ready to be listed, or they need one more test. The patients that got transplanted, I got to see, they would do better. They would get transplanted and start getting to go out and travel and enjoying their lives and not being hooked to a machine. And for me, it's just being the one that gets to make that call and say, hey, we got a kidney for you. Come on in. And getting to see those patients, working with them before the transplant, getting to see them, and then bringing them in for the transplant and seeing the difference that getting a healthy kidney and the difference of having a functioning healthy kidney in their body, what a difference that can make in their body and how they feel and just their outlook in life. It's very rewarding.